Welcome back. My next guest is Dr. Imam, who is a cardiovascular surgeon. Welcome.
Thank you very much.
Well, now we just talked to a bunch of cardiologists who use catheters to go up and fix the heart. You're a surgeon who uses a knife to crack the chest at times, but you also use a catheter to replace a valve. It's called TAVR, and it's for aortic stenosis. So tell me, what is aortic stenosis, and what's your experience with TAVR?
Well, aortic stenosis is a very common problem in the United States. At this time, I would say there are about 500,000 people with aortic stenosis in this country, and about 50% of this 500,000 are undiagnosed. So it's a real problem out there, because these are people who are high risk of dying. Because once you're diagnosed with critical aortic stenosis, the chances of you dying at 2 years is almost 50%. To answer your question, what is aortic stenosis? Aortic valve is probably the most important valve in the heart. Valves regulate the blood flow in one direction. So as we age, the aortic valve gets hardened and it gets calcified, so it doesn't open as well. And because of that, less blood leaves the heart, and so the blood just backs up into the heart, and the heart balloons up. The other thing that can happen is, because the less blood leaves the heart, the body suffers. The body is dependent on oxygen, which comes through the blood. So the patient gets tired, you get lightheaded, you get chest pain, and you get all the symptoms, and eventually it leads to death.
Now, what does TAVR stand for, and how does it work?
TAVR is an acronym for transcatheter aortic valve replacement. Basically, it is a replacement of the aortic valve, which was traditionally done through a sternotomy incision, is done through a catheter, either through a groin incision or through a small incision on the side through the ribs.
And you pass the catheter up to the heart and do it with the catheter?
Yes, yes, exactly. Just like a heart stent. So you put it up, you place it right across where you want to be, you stop the heart for a very few seconds, and you inflate the valve, and you restart the heart back up again.
Okay, now, not everybody's a candidate for that.
Yes, that's correct. The way it stands today, traditional open heart surgery valve replacement is probably the gold standard. And it's patients who are very high risk, who are not candidates for traditional heart surgery, would be candidates for a TAVR procedure.
Now, there's different kind of valves. The TAVR is one, but are there metal? Are there pig? I mean, what's the different kinds, and what's benefits, risk of those?
Well, there are two broad groups of valves. One is a mechanical valve, or the metal valve as commonly known as, and the other one is a pig valve, which is a bioprosthetic valve, which is either made from the pig's heart or the cow's heart. And I would say at this time, about 90% of the valve replacements are done through the pig valve, with the pig valve. The advantage being that you don't need Coumadin. You just take an aspirin a day, and you don't need Coumadin, because with the metal valve you will need lifelong Coumadin. These pig valves are very well designed now, and they last for 20, 30 years, even longer.
Coumadin's the blood thinner, and all the problems that come with that in terms of bleeding.
Yes, bleeding, that's correct, yes.
Now, do you have to always replace a valve? Is there such a thing as a valve repair, or does it matter what valve it is?
Yes, it does matter what valve it is, because there are two valves in the heart, the aortic valve and the mitral valve. The aortic valve problems are more common, as we talked about aortic stenosis. Mitral valve problems are less common, but they're still out there. And mitral valve problems are really treated with mitral valve repair, where you try to conserve your own repair and try to repair your own valve, as opposed to aortic stenosis, where you actually go in and replace the valve with a mechanical or metal valve or a pig valve.
Aortic stenosis, what are some symptoms that a patient may have?
The commonest symptom that I've seen in practice is just fatigue, because bear in mind, these are older folk. I mean, these are patients in the 70s and the 80s, and they just feel they're getting tired, they don't have the energy anymore, and a lot of them attribute that to just aging. So fatigue by far is the most common symptom, but patients can also have palpitations, chest pain, getting lightheaded. That's another fairly common symptom, being lightheaded, and just passing out sometimes.
Now, as a CT surgeon, you do heart bypass surgery, and you're one of the experts in what they call minimally invasive surgery. Contrast those two types for me.
Well, in medicine or in surgery, there's a dictum, which I strongly believe in, that you fit the surgery to the patient and not the patient to the surgery. And nowhere is it more appropriate than in minimally invasive valve surgery. Minimally invasive valve surgery is actually, we do the valve replacement through a smaller incision through the breastbone, as opposed to cracking the entire breastbone. So instead of a 6 or 7 inch incision, we do it through a 2.5, 3 inch incision. The advantage being less pain, which is very important to a patient, there's less blood loss, and the recovery is faster.
And you're good at doing the small surgery and getting them out of the hospital easier and better. We thanks for watching. We got a lot of great cardiac information. We'll be back next time to provide you more healthcare information. And we thank you for watching. Take care.